I'm Matt Willis, Public Health Officer from Marin County, with an update on booster doses. Boosters are on their way and will probably be authorized for use before the end of this month. I'd like to briefly go through the steps being taken that will determine when and for whom boosters are authorized. On September 17th, the Advisory Committee for Immunization Practices will be meeting to offer their recommendations to the FDA regarding boosters. Then, for us in California, the Western States Scientific Advisory Group does another independent review to recommend California's vaccination plan. So there are layers of scientific review still ahead of us. And the reason this is important is that there is not clear consensus yet within those groups about who would most benefit from boosters and over what time frame. I'm going to share with you some of the factors I know will be debated in these meetings. We think it's important at this stage for us in Marin to have a common understanding of the promise and the limitations of boosters, since this will guide our local strategy. One of the most important debates is around the role of waning immunity. Vaccines stimulate the immune system to create antibodies, which are proteins that circulate as a kind of shield to intercept and neutralize the virus if you're exposed. Multiple studies have shown that the number of antibodies in our system declines over time after vaccination, and that's expected and not really debated. If our immune system carried high numbers of antibodies to everything we've been vaccinated for or infected with in the past, our blood would be thick with antibodies. But importantly, vaccines also stimulate a second arm of the immune system called cellular immunity. These are cells, not antibodies, called memory B and T cells that hang on for much longer and recognize when you've been infected with the virus and kick into action to create new antibodies within a few hours. This may not prevent infection as effectively, but does fight off severe illness. Studies of people who survived the 1918 flu pandemic as children showed that they had memory B and T cells into their 90s, almost a century later. So that means we can't just look at test tube levels of antibodies to know if we're protected. Many on the scientific review committees argue that we need to look more at outcomes of people who were infected after being vaccinated to guide these decisions. Here's what we're finding nationally and in our own data. As antibody levels decline, people may be at higher risk for breakthrough infections, and we're seeing that. But those more durable memory cells still protect well against serious symptoms, hospitalizations, and death. Marin County COVID-19 hospitalizations and deaths are first overwhelmingly among people who are unvaccinated. That small fraction of people who were vaccinated and had more severe outcomes had weakened immune systems or significant chronic diseases, so we understood their risk. This is one of the most debated policy decisions at the national level. Many on the federal advisory panels argue that boosters should be targeted for those who would most clearly benefit based on risk, such as older residents, people with chronic diseases, and healthcare workers. Some aren't convinced that boosters are needed for young, otherwise healthy people at all. And this influences our thinking locally. If you're fully vaccinated and don't have real risk factors for more severe disease, you're already very well protected. We've had conversations with our healthcare providers in Marin and local public health officers, and we all recognize that not everyone at this stage is at the same level of risk. So while this debate occurs at the national level and will determine the federal approach, our Marin healthcare providers and public health recognize that we need to prioritize those who are most vulnerable. This has always been our strategy at every stage in this pandemic and has led to some of the lowest rates of hospitalization and deaths in the state. Once approved, Marin County Public Health will be offering boosters in our long-term care facilities where risk is highest and where more than 3/4 of our deaths have occurred. We're working with our pharmacies and healthcare providers to make boosters available to all residents who would benefit most. And most importantly, we remain focused on first doses, vaccinating those who are unvaccinated. Moving from an unvaccinated state to a fully vaccinated state is by far more impactful than topping off with a booster shot. So if you know someone who's unvaccinated and is now ready to be vaccinated, please refer them to getvaccinated.marin.com to find a clinic near them. Thank you for doing your part.